When you look at this big country with so many people, there are some who have a lot, some who have nothing. In this state, the district we are in is one of the worst 3 districts of the state. In terms of development, in terms of literacy, in terms of economic, in every aspect. Most of these areas are tribal dominated, mainly because the tribals are neglected a lot in our country and all over the world also. In the beginning, when Asha Kiran was founded, it was founded by 3 couples, mainly doctors. The main person there, Dr. Varghese Philip, he had a burden for the poor. And so he went around the country trying to see where he would be most useful. And he came and found that this area of India was a very needy area.
So these people traditionally are agriculture based and very much steeped in their tribal culture. It has taken time and it is still in the process of changing, where their first choice would still be a witch doctor when they have a problem. The younger generations are moving on, they have seen the world. We are seeing more and more of people walking in, coming in. The trust has grown over the years, and so they know that this facility is something that can be trusted. And we are probably in a radius of about, if you take the immediate location, 40 to 60 kilometers around us, we are the only hospital. And on the rim of that 40-60 kilometers is the other 2 government facilities. The hospital is now presently serving around 15 lakh population. And over the years, it has become easier, but the earlier years were very difficult for them. So we regularly see people who travel easily. They set out at 4 o'clock in the morning. They reach here by 11, 12 in the day, traveled 100 kilometers sometimes, because this is the closest place for them. Simple things like a delivery for these people is a challenge. Getting to a hospital is a challenge. That is, more recently, they take the option of at least going to a hospital. Traditionally, for the centuries, they have been delivering in their villages.
One of the main policies of the society is that we will not turn away patients for lack of money. So anybody who comes to us who doesn't have money, we will still treat them, maybe on a concession or fully free also. But they will not go back saying that they didn't have money and that's why they were not treated. We also realize that if we do not treat a person here, or we say that we cannot treat them, the next option is too far and out of their reach, which is not possible for most of these people, because as I said earlier, they are mainly tribal and most of them are below poverty line. So what we realized is that if we turn away a patient, it's especially for serious illnesses, it's more like a death sentence.
We have been, over the past few years, inviting super specialist surgeons, operating almost every once a month. Varied things like plastic surgery, pediatric surgery, urology. These things are not done anywhere in the south of Odisha. The closest place is Berampur, which is 10 hours travel from here. So we are able to provide this at rock bottom cost to them. What would cost them easily 50,000 in a city if they go would be around 15,000 here for a surgery like that. So it gives us great joy to be able to provide these services at these prices without them having to travel to a foreign environment, an urban location where they would be lost. Language being one barrier, but culture itself would intimidate them when they get into a city. This 15 lakh population has got only 4 blood banks. And sickle cell disease, which is probably a very uniquely located and restricted to the tribal populations across the various patches in India, we have one center. And so they come in very sick. What would be shocking to an urban person, we regularly see hemoglobins of 2 and 3, sometimes 1.5, and we've seen them going down into coma, and as the blood is rushed in, they just wake up, and we know life has been saved. Young children who, without a blood bank facility, would have lost their lives. At present, we have 40 beds, and we have been providing general surgical, general medicine, pediatrics, and obstetric and gynecological care for quite a few years now. Recently, we've added on orthopedic facility also. That has been a big step forward because in the whole district, recently probably 2 or 3 orthopedicians have come in, but that is far short of the need for this area. So we thought over the coming years, we're thinking of moving to a 100-bed facility. This will be a gradual process because our population also their idea of medical care also has to grow. In the near future, beside the surgical work and the OTs that are there, we want to develop the HDU, a high dependency unit, which progresses on to an intensive care unit, because again, intensive care is a rare facility here, and we see the need to provide them these critical care services. Ophthalmology services. Again, government is the only other service provider for this, and most of blindness is preventable. So we're looking forward to professionals who will join us to start up this service. We are on a mission to provide affordable, ethical, whole person care. We know that healthcare costs are pushing populations into poverty. It is a challenge, but we have always looked at the poor as our primary target. When we see a poor family come in, it is an opportunity to serve. We also realize that they don't come to us only with a physical problem. They actually carry a lot of emotional hurt and insecurity, fear. To be able to address that is also part of our mission. We want to be culturally sensitive to them, not to be overpowering with our medical technology, skills, but yet to come down to their level so that they feel open to share with us. So even if the OPDs are rushed, we want to spend a little time with each one of them, listen to what they are saying, listen to their families' situations. Many of them, for them, this is the only place where they can come and talk about it, along with their medical issues.
We as a community here, Asha Kiran community, we believe that we can be a light to this area. Of course, we are Christian, and so it's Christ who is motivating us to do anything that any of us are doing here. Now, but being a light also means that the people around will benefit and learn and grow in their development in different areas.